Remember, Mark Klimek has said, as long as I've known him, the number one reason people fail NCLEX is they don't know vocabulary. So this is intended to help you with vocabulary. So let's go ahead and get started. Hello, Klimek Review family. It's Dr. Sharon with Klimek Reviews. I'm so excited you're here with us. Today, we're getting started again with the Blue Book. This is a book that was published by Mark Klimek. That is a book of facts that you really should know in order to do well on NCLEX. You can purchase it on Amazon. I don't make any money off of it. So you can go to Amazon.com and type in Mark Klimek Blue Book and it will come up. So we're going to be going over pages 15 and 16 today. This is actually going to be a multi-part lecture because this is suffixes, endings of words, suffixes. And there's a lot of them. And so I'm not going to do them all in one lecture. It'll take forever. So we are going to go ahead and get started with that today. And if you are interested in taking a Klimek review, please go to klimekreviews.com. We do have a business that's associated with this YouTube channel. This YouTube channel is free for you, but the actual content of the Klimek review is not covered here in the YouTube channel. And so we would encourage you to register for a Klimek review if that's what you want. So let's go ahead and get started. All right, so there's quite a few suffixes. So I'm going to go through the first 6 of them. I'm planning on there being, I think, 4 videos associated with this. And there's not really one particular topic because suffixes can Cooper, come here. So this lecture doesn't cover just one topic because suffixes have many different meanings. And so there's going to be a lot of different words and topics that are going to end up coming out of this lecture. But we're going to focus on the endings of the words that we're going to talk about so that you have a better understanding of how to interpret the words that you're reading. Remember, Mark Klimek has said, as long as I've known him, the number one reason people fail NCLEX is they don't know vocabulary. So this is intended to help you with vocabulary. So let's go ahead and get started. A 55-year-old patient with a history of diabetes mellitus presents with symptoms of numbness and pain in the lower extremities. The nurse suspects the patient may be developing diabetic vasculopathy. So the suffix that we're working on today is P-A-T-H-Y, pathy. Pathy. Pathy means disease or suffering. Okay, disease or suffering. So diabetic vasculopathy, so a disease of the vessels, vasculopathy, disease of the vessels, which makes sense because their symptoms are consistent with the disease of the vessels with numbness and pain in the lower extremities. Which of the following interventions should the nurse prioritize to manage this condition? So they have a problem, a disease of the vessels, the symptoms is numbness and pain in the lower extremities, they're a diabetic. So in order to manage vasculopathy, we should encourage the patient to maintain strict blood glucose control. That would be true. They're diabetic, and the vasculopathy is associated with the chronic hyperglycemia. So we'd want them to maintain strict blood glucose control. In order to manage this condition, we would want to advise the patient to stop smoking. Well, smoking is a risk factor for just about everything, y'all. So disease of the vessels, smoking would definitely be a risk factor. So yes, in order to manage vasculopathy, we want to recommend the patient perform regular foot inspections. Well, that's not going to change the vasculopathy, but it is going to find early any problems early associated with the vessel problem. So if it's a circulation problem, like they're not getting enough circulation to the feet, they could have breakdown in the skin, and so we could catch that early. So that seems like a good idea. In order to manage vasculopathy, we would suggest the patient increase dietary salt intake. I have to tell you, I never recommend people increase dietary salt intake, so I would not do that. In order to manage the vasculopathy, we would prescribe routine use of compression stockings. So I don't know enough about what the vasculopathy is in order to do that. The only reason I would do compression stockings if they had venous disease and vasculopathy is not the same as venous disease. It is a disease of the vessels, but they usually don't use the term vasculopathy to describe venous disease. So I am only going to pick the first 3 Those would be consistent with what I know about disease of the vessels. And so A, B, and C is what I would pick here. 2, a 32-year-old patient is admitted to the hospital with a diagnosis of thrombocytopenia. All right, so what is the ending that we're working on here? Penia means lack or deficiency of, So thrombocytopenia, cyto is cells, thrombo. So thrombo, well, think of thrombosis, which is a clot. So this would be something where penia, a lack of cells that help form clots. So what is thrombocytopenia? It's actually low platelet count, y'all, low platelet count. You should know what the term thrombocytopenia means. So a lack of platelets. Which are the cells that help form clots, right? Which of the following nursing interventions should the nurse prioritize to ensure the patient's safety? Well, there have thrombocytopenia, low platelet count, which can lead to bleeding. So we're looking for bleeding precautions. Place the patient on bleeding precautions. Oh, there it is. Yes, that's what we would do. Administer aspirin as needed for pain relief. Aspirin is an antiplatelet, y'all, so don't pick that one. Monitor the patient for signs of bleeding, such as petechiae and bruising. That sounds like a good idea when they're at risk for bleeding. Encourage the patient to use a soft bristle toothbrush. Yes, that's part of bleeding precautions. Instruct the patient to use an electric razor for shaving rather than a straight razor. So electric razors are part of bleeding precautions. So we would definitely do those 4 things for someone who has thrombocytopenia. Question 3, a patient with a recent diagnosis of pancytopenia is admitted to the oncology unit. Which of the following nursing interventions should be included in the care plan to address the patient's condition? Select all that apply. So penia means lack or deficiency of. So lack or deficiency of cells, cells. Well, what cells? Pancytopenia, many cells. So think of a pandemic. When we had the pandemic, it was widespread, right? Widespread. So pancytopenia means multiple cells that are low or lacking. And typically it has to do with both white and red blood cells. So not only do they have low red blood cells, but they also have low white cells. So they're at risk for infection. And they probably have thrombocytopenia. That's another type of cell they could be low in. They could be anemic if their red blood cells are low or if their hemoglobin level is low. So these are things I'm thinking of. Pancytopenia, low numbers of many different types of cells. So let's see what we've got here. So which intervention should be included in the care plan? Implement strict hand hygiene protocols for all staff and visitors. Well, that seems like a good idea if their white count is low. So yes. Encourage the patient to participate in routine aerobic exercise to maintain strength. I don't think so. I mean, especially if they're anemic, they could be extremely tired if they're severely anemic. And I don't like the idea of that. Maybe later, but not now. They're going to have to rest for at least a while. C, monitor the patient for signs of infection such as fever and chills. Well, that seems like a good idea if their white count is low. Assess for signs of bleeding, including hematuria, epistasis, and ecchymosis. That seems like a good idea if their platelet count is low. Or if their hemoglobin is low, and we can watch for bleeding. Encourage the patient about the importance of avoiding large crowds and sick individuals. That seems like a good idea if their white count is low. So I'm definitely going to do these 4. So pan means widespread. Cyto is cells. Penia is lack of. So lack of many cells. Okay, pancytopenia. During a surgical procedure, the surgeon plans to bisect a segment of tissue. All right, sect. The ending is sect, S-E-C-T. That means to cut, Bisect means to cut into, bisect a segment of tissue. Which of the following is the nurse's primary responsibility in preparing for this part of the surgery? This part of the surgery, y'all read the question carefully. It's not a general surgical question. It's specifically related to bisection. Sect means to cut in two. So we're cutting something in two. Ensuring that the appropriate imaging studies are available in the operating room. Well, we may need to do that, but that doesn't have anything to do with bisection or cutting. Verifying that the patient has been placed on clear liquid diet preoperatively. That may be appropriate. I don't know what kind of surgery it is. I don't know if they were under general anesthesia or local anesthesia, but that doesn't have anything to do with the bisection. C, confirming that the surgical instruments for cutting and suturing are sterilized and ready. That sounds like it's specific to the bisection. Assisting the patient performing deep breathing exercises preoperatively. Well, we would want to do it postoperatively, but that's still not specific to the bisection. We want to make sure that the instruments, the surgical instruments for cutting, are there. So read the question carefully. Make sure you're answering the question that's being asked. Okay. A 45-year-old patient, female patient, is scheduled for a mammoplasty. All right. What ending are we working on now? Plast. P-L-A-S-T, or plasty means plastic surgery on a specific part. Plasty or plastic surgery on a specific part. So mammoplasty. So she's having breast surgery, breast. So she's having breast surgery. It could be breast augmentation. It could be after a double mastectomy. Maybe she's having reconstruction. We don't know. We just know she's having plastic surgery on the breast. So she's scheduled for this. Which pre-op teaching point should the nurse include to ensure the patient is adequately prepared for the procedure? All right, let's make sure she's ready for this surgery on her breast. Explain the importance of taking an aspirin every day as instructed by the surgeon. Well, aspirin causes bleeding. They're going to be cutting into her. We don't want her to take an aspirin every day. That's out. So no. Instruct the patient to perform deep breathing and coughing exercises postoperatively. Well, she's having surgery. She's going under general anesthesia for mammoplasty. So she would need to do coughing and deep breathing after that. So true. Advise the patient to avoid eating or drinking after 8 a.m. on the day of surgery. Y'all, this is general surgery. It's general anesthesia. So she has to be NPO after midnight. So 8 a.m. on the day of surgery is not appropriate. Discuss the potential need for drainage tubes postoperatively and their care. Yes. I don't know what type of surgery specifically she's having, but there is a potential need for drainage tubes. So whether she's having if she's having augmentation, she may not have to have tubes, but she will if she has to have reconstruction. And since I don't know which one it is, it says the potential need. So since it doesn't say she will have to, I can discuss the potential need. That's appropriate. Inform the patient that heavy lifting and strenuous activities should be avoided for several days after the surgery. Y'all, no. Most of it should be 6 weeks. Okay, 6 weeks. If you don't know how long post-op restrictions should last, your best guess is 6 weeks. Now I'm talking after surgery, not after a procedure. Like in cardiac catheterization, that's going to be for a few days, right? But for a surgery, an actual surgery where they cut into the patient, the restrictions are, if you don't know that, I would always guess 6 weeks. So heavy lifting should be avoided for 6 weeks, not just for several days. So B and D are the things that we would want to make sure that she knows about. All right, 6, a 60-year-old patient is diagnosed with atherosclerosis. So sclerosis is the ending or the suffix here. This is hardening of a tissue by inflammation, the deposit of mineral salts, or an infiltration of connective tissue fibers. In any event, it is a hardening of a tissue. Well, what tissue? Sclerosis, hardening of what? Athero. Athero refers to the arteries. It could say arteriosclerosis, atherosclerosis. They're slightly different, but for all intents and purposes, we're going to treat them the same way. So atherosclerosis is hardening of the arteries. Which nursing intervention should the nurse include in the patient's plan of care to manage the condition and reduce the risk of complications? So how do we manage atherosclerosis? Well, hardening of the arteries. Well, how do the arteries harden? Well, they harden usually in response to either high cholesterol levels, hypertension, diabetes can cause that, but it doesn't say they have any of these things. But we're going to go ahead and look and see which ones we want to manage. So encourage the patient to follow a diet low in saturated fats and cholesterol. Well, yes, even if I don't know if they have high cholesterol, I'm still going to encourage them. If they have atherosclerosis, I'm going to encourage them to follow diet low in saturated fats and cholesterol. Educate the importance on smoking cessation. Yes, absolutely. Okay. And don't say, well, how do you know they smoke? Look, it doesn't matter. I'm going to make sure my patients are not smoking. Okay, because smoking definitely increases the risk for hardening of the arteries. So B is absolutely yes. Advise the patient to engage in regular aerobic exercise. So I know exercise can reduce cholesterol and it can reduce blood pressure. So, hey, I'm going to do that. That's a really good way to prevent atherosclerosis. Monitor the patient's blood glucose levels regularly. Now, if it said assess or screen for diabetes, I would definitely pick it. But this says to monitor the patient's blood glucose levels regularly. Unless I know they have diabetes, I'm not going to monitor them regularly. I'll screen them. I may check them every 6 months or every year, but I'm not going to do it regularly unless they tell me they have diabetes. So I'm not going to pick D. Administer the prescribed simvastatin. Well, it's prescribed, and what is it for? The statin meds are used to lower cholesterol, and since it's prescribed and it can lower cholesterol, it can be used to manage atherosclerosis, so I like E. F, administer prescribed ondansetron. Ondansetron is Zofran, and Zofran is for nausea, which has nothing to do with atherosclerosis. So the options that I should pick for managing atherosclerosis, include in the plan of care for managing atherosclerosis, are A, B, C, and E. 7, a 32-year-old pregnant client at 18 weeks of gestation is preparing for an amniocentesis. So our suffix here is centesis. Centesis is a perforation or a puncture, a perforation or a puncture. It's often related to perforating or puncturing in order to pull something out. So an amniocentesis is perforating or puncturing into the area where the amniotic fluid is, and then we're pulling out some of the amniotic fluid. Okay, so centesis is puncturing the area where the amniotic fluid is and then pulling some of it out. Before the procedure, which of the following statements indicates the client needs further teaching? I will need to have a full bladder during the procedure to help with ultrasound visualization. Well, I know that a full bladder displaces the uterus, and I know that because after delivery of the baby, if the uterus is off center, I have them empty their bladder so the uterus can get back to center. So actually having a full bladder displaces the uterus, so it's really not going to help me. So I don't like A. I may feel a slight pressure or cramping when the needle is inserted. Well, centesis involves puncturing something. So yes, that makes sense to me that B would be true. C, I should avoid strenuous activity and heavy lifting for the next 24 hours after the procedure. So that sounds good to me. It's not surgery, y'all. It's not surgery. It is a procedure, and it actually uses the word procedure. So surgery, I would want to have, because surgery involves cutting and surgery involves anesthesia. And so after that, especially when you have cutting, you have to have longer restrictions. But this is just a puncture site that's not cutting anything. So I'm okay with restrictions for 24 hours. There's a risk of complications such as infection, leakage of amniotic fluid, or miscarriage. That makes sense to me. If I'm putting a needle into the amniotic fluid, the baby's surrounded by this, certainly a miscarriage could happen. If you're puncturing it, certainly leakage could occur and something could get in there. There could be infection. So the only one that I don't like is A, and I'm looking for further teaching. So I'm looking for the false statement. Further teaching is false statement, and A is the false statement. All right, last question. A 65-year-old patient with osteoarthritis is scheduled for an arthrocentesis of the right knee. Which of the following nursing interventions should be included in the patient's care plan before and after the procedure? All right. Osteoarthritis, it means arthritis of the bones, generally of the joints. Okay, osteoarthritis is generally breakdown of the joints and causes pain. And they're scheduled for an arthrocentesis. Well, centesis is what? A perforation or puncture. So we're going to perforate what? Arthro. Arthro is joint. If you don't know that, arthro is joint. So arthrocentesis, we're going to puncture or perforate the joint. Why? Well, I suppose they want to draw some stuff out and see what's in there. Okay, that's usually what centesis means. We puncture it, we pull something out, we evaluate it, see what's going on. So my guess is that's what we're doing with an arthrocentesis. Okay, So what do we want to include in the patient's care plan before and after the procedure? All right, educate the patient about the procedure. Yes, I can tell them what's going to happen as much as I know, including its purpose. Why are we doing it, and what to expect? I guess so. I mean, that's fine. I can educate them about that. B, instruct the patient to apply heat to the affected joint immediately after the procedure. Y'all, we never do heat right after a procedure. If anything, we do ice. If it's really swollen, we may, but often we don't put anything on it. We just are going to let it heal unless it gets really swollen, in which case we can put ice on it for maybe 20 minutes off for 20 minutes, on for 20 minutes, off for 20 minutes. We can help with swelling if that's a problem. So B is no. C, ensure informed consent is obtained before the procedure. Well, yes, we do ensure that informed consent is obtained. We obtain the informed consent. We don't explain the risks and benefits. And risk and benefits is different about educating them about the procedure. If it said educate them on the risks and benefits, I would say absolutely not. I'm not going to do that. But I can tell them why they're going. I mean, I can read the progress note and explain to them why they're going. This is what the doctor said. They said they're going to go in and they're going to do this, and so forth, right? So I can do A and I can do C. D, monitor the patient's vital signs and the puncture site for signs of infection after the procedure. Absolutely. That's one of my primary responsibilities. E, advise the patient to avoid strenuous activities involving the affected joint for 6 weeks. Okay, y'all know this is not surgery, and it even says post-procedure. This is sticking a needle in the joint. It's going to be a local anesthesia. It's not surgery. There's no cutting involved. So no, they're not going to be avoiding activity. Probably 48 hours, 72 hours would be my guess is what post-procedure restrictions would be. Oral antibiotics for 7 days to prevent infection. No. And don't say, well, it could get infected. Well, it could. So if it gets infected, then we'll put them on antibiotics. But if the physician is doing it the right way, they should not get an infection. If they're using all sterile procedures like they should be, there should be no infection. So A, C, and D are the correct answers here. So that is suffixes, and I will continue with suffixes throughout the next several videos. I hope this was helpful to you. And if you want to sign up for a clinic review or for our small group tutoring, go to clinicreviews.com to sign up for that. I hope you have a great rest of your day. Thanks.